think the number one that needs to be determined is what's the need in your community and your surrounding. Once you have determined that, then you have to determine, do you have the force to do that? So do you have enough physician? Do you have enough supporting staff? Do you have the community on board? Once you sell that to the community as well, then you get even more resource from that. And then let's not forget the RHAs. Some are more cooperative than others, but they're not impossible to get involved. And then once you determine that, then you can make an action plan and then decide what you can go from there. So I think that the number one is, it's not numbers, it's to identify what's the need. We identified that we had people that could not travel, therefore we traveled. Some other community might be totally different, but that's where the start should be. Well, our primary clinic is based in Arcola, and from Arcola then we go to 4 different sites. One is Lampman, which is about 50 kilometers away, and we go there 1 day a week. We go to Stoughton 2 days a week, which is about 40 kilometers away. We also go to Wowotown 2 days a week, and that's about 65 kilometers away. And then we also managed to do a primary clinic, basically at the White Bear Reserve, which is about 25 kilometers away.
Why is it important you travel to those places?
Well, the reason we decided to expand our clinic that way instead is that because of the distance, then for the elderly and for the children and people that have no vehicle, it's very difficult to come to our clinic, and especially within a time frame. We decided we wanted to reach the children, and they're at school. So for them to come after school at 4 o'clock, they will miss our time at the clinic. And we thought the easiest way to travel is that I displace one of us rather than displacing 20 patients, 30 patients in a day.
Do you take staff with you?
Yes, we do. In some of the clinic we do, and some other clinic they provide us with a staff locally. We always try to promote and use the local people, and the reason for that, they know the people in their town. So they're a great advantage, which for us, we have a clinic, our policy in our clinic as well is that people that are sick, that need to be seen, will be seen that day. And we have a policy that as well towards children, as we want to do prevention, then children, they never turn away. So if a mom calls and she's concerned about her child, she will be seen that day. We'll squeeze her in. Now, you may not always get to see the physician that you are mostly doing medicine with, care with, but you will be seen by a physician within the clinic, and the information will be shared with your primary care.
How is the setup in Arcola improving access for patients to see their doctors?
A group of interested citizens got together, and we got all of our towns and municipalities together, and we run a corporation called the Moose Mountain Healthcare Corp. We actually contract our doctors and run the day-to-day operations of the clinic. That provides the opportunity for us to have enough physicians to cover the on-call duties at the hospital and not necessarily have a big number in the clinic. And we believe that that provides primary health care because our doctor sees an average of 27 patients per day. And so people feel they have time to discuss their concerns. They have as much time as they need, whether that's 10 minutes or a half an hour. It's just a little bit different of a makeup. The other thing we do is we provide outposts in surrounding communities so that we, rather than the people having to come to us, we send our doctors out and we pay them for their travel time, and they spend a day or a half a day in those outposts.
Why is it important that patients have timely access to their physicians?
We just believe it's better health care. What we're finding in rural Saskatchewan is that people were waiting until they just were very sick before they made the trip to 60 miles away or 100 miles away to get a doctor. And it would often take 3 weeks to get into a doctor in a community 60 miles away. Whereas what we do is we guarantee patients be seen within 48 hours, and our kids are seen that day if they're sick.